So hi everybody, greetings colleagues. I'm delighted to be coming over to Cairns to speak to the Wonca Rural Conference in 2017. My name's Professor Amanda Howe. I'm the president of Wonca. I'm also, and more importantly perhaps, a GP of more than 30 years standing in the UK. Work at a university in East Anglia, which has a new medical school that I helped to set up, running now for about 10 years. And I've been involved with Wonca since the last 20 years, originally as interested in work on women's careers in family medicine, which obviously brings up the rural theme for some people. The county I work in over here is a rural county. It's farming, it's tourism, it's, you know, the way people live their lives. And our students get to go out 40, 50K away from the med school to different practices every week for the 5 years of the course, except when they're on hospital placement. So I think, you know, we try to give our students a vision of rural practice as far as it exists in the UK. But I've learned a lot from the Wonca Rural Working Party people over the years about real rural and remote practice. And I think that's still a challenging vision to help young doctors to understand in some medical schools around the world and afterwards. So I'm very much into the business of helping people to get residencies which showcase rural opportunities and make that a positive thing. When I come to Cairns, I guess the discussion I'd like to have through my keynote will probably be about leadership and advocacy, and also making rural practice an attractive place for people to choose and to stay in. And I had a strap line running through my head about, you know, barriers, burnout, and breaking the mold, because I do think that in my era and in the younger generation who I'm teaching, I still see quite a lot of resistance to the idea of working outside big urban settings. And I still think we need to be going on with very strategic discussions about how to break that down or how to stop it arising in the first place. And then the advocacy role of rural doctors, of course, is strong for their own communities, for their own resources. But I think we also need to be talking between Wonca and the rural communities of leadership about how to be really effective as advocates at the systems level, because that's something that I as a GP have found you can't do on your own. You can't only make a difference to the way the system works in your own place. And maybe that's where organisations like Wonca and RACGP and ACRAM can play a role. So that's another bit of the conversation. And then the third bit is, how do you sustain yourself? Because I think particularly in rural, you're very exposed to the community. Everybody knows your business. They know if things go right or they go wrong. And that's a fabulous privilege, but it's also an enormous responsibility. And I'm interested in how we train people to be resilient in that setting, and also to help them to retain resilience in that, you know, pretty challenging world some of the time. Because if people go there and it doesn't work for them, you lose your local doctor, and then, as we know, the whole resourcing issue breaks down. So I think those are the three things I'm particularly interested in: the leadership, education and workforce stream in your conference. And that's probably where I'll be contributing. But of course, I'll also be there listening to everything else that's going on and having the conversation about how can Wonca help rural to give the service it gives to the majority of patients around the world. So that's it. I'm looking forward to it. Let's all prepare well and be excited and use it as a real opportunity to refresh and to learn. Thanks a lot.